Ladies and gentlemen, this is the first webinar that UKDHC is running to highlight courses, master's degree courses in the UK that have been designed to help people improve their digital health understanding and skills. I'm Professor Angus Wallace. I am a director of UK Digital Health and Care, and I'm going to introduce you to our chair today, who is Anita Fung. Anita is a GP from London and is going to introduce herself. Over to you, Anita.
Hello, thank you so much, Angus. Hi, everyone. Good evening. My name's Anita. As Angus said, I'm a GP working in South East London. I've had a bit of dabbled in a bit of clinical trials, worked as a GP, currently working as a GP, and I've been exploring a career in digital health for the last 2 to 3 years. It's been an absolute pleasure working with Angus. And I hope that by helping host some of these webinars, it will help me direct myself as to what I would like to do, how can I further and upskill in pursuing a career in digital health. So to kick off, the format of these webinars is a bit like a university challenge in a way. We're going to have 2 universities come up and present their master degrees, digital health related or clinical informatics related. It may be more to do with medicine, it may be more to do with health and social care. We don't know. That's the idea. They'll present their courses. Some universities will have current students on their course or previous students from their course and would hopefully share their insights and experience of the course themselves. And hopefully towards the end, we can have a chance where you can ask any questions to find out more about the course. Okay, so without further ado, we're going to start off with Dr. Lisa McCann, who will hopefully introduce themselves. They are a senior lecturer of Computer and Information Sciences at the University of Strathclyde in Glasgow. So Dr. McCann, please could you give us a brief introduction about yourself and how you came to become a lecturer at the University of Strathclyde?
Yes, no problem. Thank you, Anita. So yes, hi everybody. My name is Lisa. I'm a senior lecturer in digital health and care in the Department of Computer Information Sciences, rather than a senior lecturer in information sciences, if that makes sense. Slightly different and nuanced role there. My background is actually in psychology and health services research and health psychology. And I have been working at the University of Strathclyde since 2017. And I've been the programme director for the MSc in digital health systems for the last 2 years fully, and 2 years prior to that I shared the role with a colleague. So I've been involved in the programme for a number of years now, and it's lovely to be here and to meet you all as well.
Thank you so much. Thank you so much. And who have you brought along with you today?
So I have one of my current students with me, Duke, who is on the current programme, the 2023-2024 cohort. And Duke is one of 6 full-time students we have on the programme this year. We have smaller numbers this year and smaller numbers than the UCL that you hear about in due course. And I'll perhaps let Duke introduce himself as well.
Yes, please. Duke, nice to meet you.
Nice to meet you, Anita. Nice to meet you, everyone here. So let me give a brief introduction about me. So I am Duke Trần. I am originally from Vietnam, and I'm a current student at the MSc Digital Health Systems at Strathclyde. Just a little bit about my background. I had a degree of medical doctor back in Vietnam, and I had some experiences working in public health projects as well as in some academic research about digital health landscape and policy in Vietnam. So I'm very happy to be here to share some of my experiences with you about the course.
Thank you so much, Doug. And so besides the University of Strathclyde, we have Dr. Holger Kuntz, Associate Professor, Institute of Health Informatics from the University College London. Please could you briefly introduce yourself and how you came to become a professor over there?
So thank you very much for the introduction. Yes, I'm Holger Kuntz. I'm an associate professor at UCL. I work in health data science and medical informatics for many, many years. I think I started working in that area 20 years ago, starting in medical imaging, then health data science. Over the years, we used more machine learning and artificial intelligence. Some of the methods we already used 20 years ago. We just didn't call it AI at this time. But gradually, we developed into this AI role, and we do a lot of this in our teaching. I'm the program director for the MSc in Health Data Science, and I'm looking forward to interesting questions.
Thank you so much. So we're going back to you, Dr. McCann and Lisa. Why don't we find out a bit more about your course, your master's?
Sure. So I think the easiest way, just for the questions about the modules, I've prepared a couple of slides just for reference. So I will share these. Hopefully you can see that okay. Yeah. Okay, so you've heard the introduction, but also just to note, as well as being the program director, I'm also module lead for 2 of the core modules that students take within the program, one of which is the digital health implementation module, and the other is the research methods module, and I'll explain where they come in our program in due course. So just for familiarity, before I move on to that, just want to highlight to people where we are in Glasgow. If people are not familiar with Glasgow, we're a city centre based campus. There are 3 different universities in Glasgow: University of Glasgow, which is over in the West End, Caledonian University, which is also in the city centre, and ourselves, Strathclyde, which is right in the city centre. So we're really accessible for people who may need to travel to campus from different locations by bus, railway and subway as well. And we're being right in the heart of the campus. We do have some green space, as you can see from the photo here. This is a kind of snapshot of part of our campus. We're all contained within that city centre space. The building on our left is called the Livingston Tower, which is where I'm based, and our Department of Computer and Information Sciences is based up in the top levels between levels 11 and 14. So we have nice views of the east and west of the city. This is our kind of brand new teaching and learning building, which has a student union, various teaching resources and rooms within there, and joins into one of these previous buildings that has been adapted as well. And this is all our space that you can see here too. Our university has won a number of awards in recent years, and the Daily Mail University of the Year in 2024, Times Higher Education Award 2 years, which is a unique offering, I think, in terms of where we stand at Strathclyde. And we have various different anniversary awards that we've received over different years. But this is actually our Jubilee year this year. In terms of our programme, it's full-time and on-campus based. We have 120 credits of top material taken over 2 top semesters. Semester 1 runs September to December, and then semester 2, is January until March, early April, depending on the schedule. And then we do a 60 credit research dissertation project over the summer months from June to August time. In terms of what our master's offers and what it's like, we consider it to be a focus on the whole systems approach. So thinking about digital health, it's more than just the technology, it's about the different ways technology is used to help deliver preventative and personalised health and care that is supported by technology. So we have that whole systems approach in our teaching. And if I go one slide and come back to this, this will make more sense. So here's an overview of our core taught modules. As you can see, we have 100 credits that make up those core taught module program. And then we have students can choose 20 credits from a choice of 30 credits to make up to the 120. And we split the 120 credits over the course of the 2 semesters. Some students might have a slightly higher weighted semester 1 if they take the 2 electives in semester 1, or they'll have that kind of balance if they take the semester 2 option as well. And we cover things including implementation. And so how do you think about implementing different technological systems in different settings? Think about the role of implementation science in that space, looking at different examples of programs and systems that have been introduced, as well as barriers, facilitators, and different frameworks and toolkits that can help guide those processes. Semester 1, we also have a heavy focus on design, and that design of usable systems modules, a 20-credit class, where students learn about the fundamentals of designing usable systems and different techniques and methods they can use to help develop usable systems in that space as well. We also focus on health information governance and healthy aging in semester 1, so think about the legalities of using data and health data and sensitive data, and also healthy aging, how you design systems for an aging population given the context that we're living in as well. In semester 2, we move into the second part of the digital health implementation class. It's split over 2 semesters. It's a long and thin class, as we call it, so we kind of incrementally build the context and the concepts there as well, and then introduce more of the data piece in terms of the decision support and health analytics, database fundamentals, and that research methods piece leading in to the dissertation into semester 3. As you can see, they've got different class codes here. The CS codes mean they're all core computer information sciences classes, and the MS codes are from our management science. So we have 2 classes that students can take in partnership with our management science colleagues in the university as well. And then students move in to that dissertation period, that 60-credit dissertation period in the summer months, depending on progress prior to that as well. I'll stop there for now and take the next question if that helps. Oh, you're on mute.
Thank you so much, Sarah. I think there's just such a great wealth of modules and variety. I think being a bit kind of thinking about myself, I'm particularly interested in health optimization. By background, I've looked into kind of precision medicine and longevity medicine. With the module on healthy aging, can you tell me a bit more about that? What's covered in that module?
I can do, yes, and I'll also like you hear from Luke on that one as well, since he's taken the class as well. But the focus is around understanding the aging process and that kind of lifespan, and what the role is of technology and the increasing role of technology, particularly to help support people in that aging life course as well. Thinking about the differing needs of older people and what that might mean in terms of interaction with technologies and the role of technologies to support them, and thinking about the inequalities and the digital divide and how we can understand those concepts to help ensure that technologies that are used, developed, deployed are mindful of the needs of those particular aging populations as well. And we use different examples from different health settings, different charities, different guest speakers that come in from different local organisations who talk about the technology work that they've done and the role it has to help support older people in the community. Doug, anything you want to add from your perspective of a student from the class?
Yeah, I think that's basically what we were taught in the module. And I think for me personally, I've learned a lot about digital divide and how we can, address digital divide problems when we implement new technologies. And personally, I really enjoyed the module.
Okay, so you did the module, great.
Yes,
Because I think the new buzzword is not so much about the lifespan, more it's about health span, and trying to kind of promote longer health throughout someone's life, essentially. Great. And I did go through I did do my research and go through your website, and it says here that the master's students get an opportunity to work with the NHS, Scottish Government, industry, third sector, and the Digital Healthcare Institute during their final dissertation project. Can you tell me a bit more about this? Or maybe this is a question for you, Doug. Like, in your final dissertation, did you have a chance to work with some of these stakeholders?
Yes. So my dissertation is about developing like a prototype for a mobile app that can help carers to kind of find the support services that can help them to, find a break from their role of giving care. And so for my dissertation, I have planned to work with some charities in carer support, such as Shared Care Scotland. And although I cannot say more because I haven't officially started the dissertation yet, but I really hope to talk to the stakeholders in in informal carer support and to work with them. Yeah.
Thank you, Doug. Well, I guess we'll ask you in a couple of months' time what your experience was and what you learned from that as well. Okay.
Sure.
And when I was kind of doing my reading on the website, I came across the Digital Health and Wellness Research Groups. Lisa, can you tell me a bit more about that? Because it sounds, the work that they do sounds pretty impressive.
Yeah, we are a really active research group. So Digital Health and Wellness Group is one of 6 research groups within the Department of Computer and Information Sciences. And we have people from various backgrounds. We're a very multidisciplinary team, and that's one of our unique offerings for our digital health systems course, is that we are a multidisciplinary team with people from psychology backgrounds like myself, nursing backgrounds, public health, sports science. So we have a range of people's interests and backgrounds and disciplinary activities that contribute to that. And we're involved in things like the development of different technologies, the deployment of those in different settings, the evaluation of those. We work within health and social care environments. We work with people across the life course and increasingly across the health course, as you said, to use your phrase, think about people keeping people well and the wellness aspect, as well as trying to support people with particular illnesses or conditions. We have a lot of expertise in things like remote monitoring of symptoms and of conditions. So those undergoing chemotherapy, for example, people at the end of life and palliative care, carers work, as Luke mentioned, physical activity space as well. So we're a really active group working in different dimensions, and we integrate the research into our teaching. So very much kind of research-led teaching and bringing examples from our real life work that we do and using that to kind of facilitate those discussions with students in the taught environments that we have too.
Thank you. And you gave a bit of kind of information about the building and campus itself. Can you tell me a bit more about the facilities that you have? I think you've got quite 2 big computer labs, is that right?
So yeah, so we're really fortunate in the Department of Computer and Information Sciences that we have our own labs that students can use to work in, during their studies and deliver some of the classes there in that Livingston Tower, the tall building. And we have that really new teaching and learning building which has kind of state-of-the-art facilities and student study hubs, individual spaces, group study spaces, a library that's really well resourced and accessible, state-of-the-art sports facilities that students can access at really discounted rates as well, and think about their own health and wellness and well-being as part of the study, so not just studying all the time, that they've got those other curricular activities as well. And we're a small enough campus that students can bump into staff, and we're very accessible. And I think that makes it unique as well, that students can know where we are. We've got allocated office space that students can freely drop into. We advertise office hours where we're very accessible to students for meetings, discussions as we need to as well. So lots of things really well contained in that environment. And we're known as a leading technological university and a place of useful learning, and we like to apply that in our teaching-based activities as well as our research activities.
Perfect. And remind me, I may have missed it, the format of the course itself, is it face-to-face, is it remote, is it hybrid? Because you offer a lot of very interesting modules, but some people might not be able to go all the way to Glasgow for that.
Yeah, so we are a face-to-face campus and a face-to-face programme. with one exception in that CS 957, the Research Methods class, is a hybrid module, and it's a flipped classroom module. So the content is delivered through pre-recorded mini lecture videos, and there are fortnightly face-to-face tutorials that build on those lecture content, and the students do small group-based activities driving towards their assessment, where they're asked to write a research proposal that leads into their dissertation that they start in June. So they've got a bit of a segue into the dissertation process by working on that as one of their top component assessments as well. But we are predominantly a face-to-face on campus post-COVID, certainly. We have gone back to our mainstay of being face-to-face on campus.
And I guess that that nicely kind of moves on to Duck. I mean, you mentioned that you're a graduate from Vietnam. What made you choose a master's at Strathclyde, and how do you kind of navigate the logistics of that? Tell us more about your decisions and your thinking processes.
Yes. So my background is about kind of a mixture between medicine and public health. And like from my work experience, I had a chance to work with technologies like some AI software that can kind of tell you the risks of chest X-ray, which is probably the chest X-ray may have abnormalities related to TB. And from there, I got interested in technologies in healthcare. And after that, I was lucky to be able to involved in a research project which implements new technologies in the ICU of a hospital in Vietnam. So we aim to find proof of concept for technologies like clinical decision support system and remote monitoring devices. And we also have like a implementation package of the project where we look into the policy landscape, digital health policies, which can inform the implementation of new technologies in the hospital setting in Vietnam. So that's how I got interested in digital health. And from my experience, I always want to have a broad understanding of the field. I want to kind of upgrade my skills and also my perspective about how a person with a medical background like me can work in this field. So when I look for courses about digital health in the UK, I found the master's course at Strathclyde is a very comprehensive course because it gives me like a wide range of skills and knowledge in digital implementation, in designing digital systems. Also, we were taught about big data. So it covers a wide range of skills and knowledge. And that's how I decided to apply for this course, and I got the offer, and I'm here. So so my experience so far with the course is very good, and I highly recommend the course to anybody who wants to have a good basic background information knowledge about digital health.
Thank you, Doc. And of course you would say that. That's why you're here, right? To kind of promote your course. Let's kind of bring about a balance behind what you've said so far. Could you share with us perhaps, one of the highlights of being on the course, and perhaps something you would have liked to improve, or something you found quite challenging with the course?
Yeah, I think probably one thing that I particularly like from the course is I feel like the assignments are thoughtful built so that we can work on problems that are very close to the problems in reality. we were asked to, form an implementation plan for new technology. And we are encouraged to think about problems in real life. So I think that is very good. And sometimes I just feel myself lacking a bit of time to work on the assignments and also to reflect on what I've learned. I think that's probably because of a lack of my time management skill, or because sometimes I just feel like the 1 year duration of the master's course in UK is a little bit short for me. But yeah, I think so far I enjoy the course. Yeah, and yeah, I think that's all I can say.
Okay, I think you're probably being too hard on yourself. I think there's a lot to do in Strathclyde, Glasgow, lots of culture, and actually you're learning a bit more about a different healthcare system. So all of that will take time, a lot of time. And moving forward, after you complete your dissertation and obtain your master's, I have no doubt that you will, Doug. What are your aspirations for your career in the future?
Yes, so I have some experience in digital health, but in terms of academic research, and I have always wanted to try working in the industry. I want to build mobile apps. I want to work with IT people and build something. And so with the skills in design that I've learned from the course, and also the skills in implementing digital health technologies, I really hope that I can find a job probably in a digital health startup or like a digital company to work in projects outside of academic research. So I think that's my plan for now.
I mean, that's a great plan. It's what I'm also trying to do. And maybe not build an app myself because it takes a lot of time, but do connect with us. There's a lot of, kind of communities for people who are into digital health and startups. And I'm sure there's lots of networking to be done here. And one final question for you, Lisa. I am aware that there are some scholarships available. Is that right? Could you tell us a bit more about that? When I was looking at the website, I was really pleased to see that there are scholarships available, especially for women of STEM background, so science and technology backgrounds.
Yeah. So I'll just screen share again if that's okay, just because I've got that information on a slide. It's probably again easiest for referral. Let's get down to that. Hopefully you can see that okay, but the DHI scholarships, yeah. So there are two routes definitely that we can support and try and encourage applicants to follow for funding. So there is part of our unique offering is that we have the Digital Health Innovation Centre located on our campus. That's one of the flagship innovation centres from the Scottish Government. And they are based on our campus, and we do have guest lecturers from colleagues from that organisation work with us as well. And they have a funding through the Scottish Funding Council that offer funding for master's scholarships, and our Digital Health Systems Masters is one of the compatible funding avenues for that. And they offer that at just over £7,500, so slightly less than what the fee is per year for a Scotland or rest of UK domiciled student. But the idea is that the faculty pick up that deficit or kind of zero out the deficit in terms of that funding opportunity. So the costs for the fees are zero to the student applicant. It doesn't cover living costs and such and so on, but it does cover their fees. And we have the ability to apply for these scholarships again for the next academic year for 24-25. The students need to meet a number of different criteria, and I'm happy to go through those with any potential applicants. But it's about being based in the UK and being based in Scotland as part of that application process as well. There's been a slight change in the criteria this year They only used to be available to Scottish domicile students, but there's been a little bit of widening of that criteria this year as well. So that's one route for applicants if they are UK based. And as long as they can write a tentative indicative research proposal at the point of application that meets with one of the strategic themes from the DHI for the next year that are listed here, then that helps us understand the ability of that student to apply and be awarded a potential scholarship as well. We will do some kind of scoring and grading of those if we have more applicants than we have scholarships available. So it's really important to make the best case for those as well. So that's one avenue that we can definitely support. We've had about 35 students over the years doing the programme who had this scholarship funding. So it's a really positive route to pursue, and it opens up other opportunities to meet with other DHI scholars from other institutions, other organisations, other programmes, as well as meet the staff from the DHI, which is just down the road from us. The other option we have for international students, for female international students, is the British Council Scholarships for Women in STEM. And we have had a student on last year's programme who was successful in applying for and being awarded one of these scholarships as well, which facilitated her studying with us. And she was from Pakistan and has gone on now to do a PhD at the University of Coventry. So opened up the avenue for her as well in terms of her potential studying route as well. So some really good funding opportunities out there. More than happy to discuss with potential applicants what route might be available to them. And I certainly say that DHI route for students who may be UK based is really positive, and would encourage that they think about that sooner rather than later, as the application deadline for those is the 30th of June this year for the incoming programme 24-25.
Thank you so much, Lisa. That's all my questions for the University of Strathclyde and your masters. We can come back to you towards the end if there's any kind of final questions or any other reflections. Now, Dr. Kuntz, very, very nice to meet you. I'm sure you've been kind of like a bit restless and wanting to share how great your masters is, and now is your time. You're from UCL. My background is I'm from King's. Now, if you're familiar, there's a lot of history behind UCL and King's, okay? A bit of rivalry, friendly rivalry, perhaps.
Yes.
And you might be aware that it's all about the history, isn't it? So why don't you kind of share with us the history of your degree and how it came about?
Yeah. All right, 1 second. Can you see my whole screen?
Yeah, we can see your full screen now.
Okay, perfect. Thank you. So the MSc in Health Data Science. So your question was about the background and the history of the degree. So UCL is a very famous university. I think this is one important point for the degree. The Institute of Health Informatics itself exists for more than 25 years. Originally, there was an MSc in Health Data Informatics, and about 8 years ago, we started the MSc in Health Data Science. The Health Data Science degree has currently 82 full-time students. We have full-time students, we also have part-time students, we also have flexible students. And do you want to know the modules that are covered in the course?
Yes, please. That's what we're here. We want to know everything. Give us the lowdown on it.
Perfect. Thank you very much. So the modules are in this course. So we have 5 compulsory modules. So we have data methods for health research. Data methods for health research is a module where we use databases and SQL applied to biomedical databases. Then we have the basic statistics module, which is an introduction into basic epidemiology and medical statistics. Then we have the principles of health data science module. The PhDS module is an introduction into different type of data. What is secondary care? What is primary care? What is an EHR record? What is a read code? What is an ICD code? How do you retrieve data from a database? And we have regression modeling, which is an introduction into using regression modeling on health data, and then we have the Python module. We code in Python using examples from health data science. There's another compulsory module. It's not a typical module, it's the dissertation module. The dissertation module runs from term 1, term 2 to term 3, where students individually work on a particular dissertation project, either at the institute or with an industry partner. Students can also pick 3 optional modules. The optional modules come in very different flavors. So either they want to further specialize more in statistics, or they want to use machine learning and AI. They can even attend another advanced machine learning course in the 3rd term. We have an AI healthcare group project where students work together on a real-world problem in small teams. Then we have the public health data science module where students specialize on using data for public health purposes, obviously. And we have the Essential of Informatics for Healthcare Systems module, which is related more to health informatics and how informatics is used in the healthcare sector. I will not talk about all modules, obviously, but I'm conscious of the time. I'm just picking a few examples. So in Python, we start from scratch. People will learn to use Python and programming in Python, and they will develop a whole pipelines. So they will use data, they will do data cleansing, they will visualize data. Here, for example, for demonstrational purposes, these are GP practices, and this is the monthly spending per surgery in the UK. In that chart here, you can roughly see 10,000, you can't, but you can think of 10,000 GP practices, and this is the monthly spending. And we use this type of data, real-world data from NHS Digital for demonstrational pedagogical exercises where they have to plot something in Python. So everything is very much related to what they require possibly in a job once they graduate. We talk about different types of data. What is primary care? What is secondary care? Where do different type of data come from? How do you combine this data? And how do you, for example, develop a prediction algorithm that makes use from different data sets from different sources? We also have a quick introduction into medical imaging. What is DICOM? What is an MRI? What is a CT scan? How do you use annotations and MRI scans? How do you feed a deep learning neural network, for example, to identify whether this patient here has, for example, a particular condition or not, or using it for a diagnostic test or for CDSS, for clinical decision support system. We also do NLP, natural language processing, large language modeling. For example, how to use data, free text data from electronic health record systems to retrieve some information or to see whether a patient has a particular condition based on the free text description. And that is also a very challenging area, but it's developing very strongly. Especially free text is not so easy, and people will learn the key methods, but they will also see how difficult it is still in practice to apply NLP. All what you see is always informed by latest research. So we also include both in our AI teaching as well as for NLP teaching, normally the latest papers, and we discuss papers. So it's not just face-to-face teaching where you just get knowledge, someone is presenting your knowledge. We also have small seminar style work groups where people look at latest papers from 2024, from 2023, and we discuss them and how they could possibly inform research and teaching. So I'm not talking about this is a lot about AI. I think the key takeaway message is for the dissertation module. We had many different projects at different stages, but I think the key thing is there's something for everyone. If you have a particular interest in a particular disease or a particular condition combined with a particular method, you can do that. And we have a huge plethora of different topics And there is something for everyone in that. And this is just a very small list of projects we had. We had roughly more than 300 dissertation projects in the past. So there's certainly something that someone could do. And you can also combine that. If you are a part-time student, you can kill one bird with one stone. So if you do something in your clinical routine and you already have access to a particular data set, you can also write your dissertation project on your clinical practice. We are quite flexible for this, and we enable this. Right. This is your next question. Anita, this is your next question.
Thank you. Yeah, so I think Lisa shared with us the registration deadlines for courses, and these are the dates for UCL. Is that right? Let's have a look. It's in October or June time if they need a visa, and it's the same for if they don't require a visa. Is that right? Is that how I'm reading it?
It's slightly different. Students, international students who require a visa, they need to apply earlier because we need to organize a visa for them to study at UCL. But UK students, they have a longer deadline. They can apply up to the end of August. So up to the end of August, home students can apply for the degree. And these are our two main deadlines. And then this is your next question.
Oh yes, I remember this. I when I was doing the reading on the website, I was rather impressed that there are part-time options, full-time options, and there's flexible as well. So maybe, Doug, this is something that you would need, Doug, because you mentioned that there's a lot to do in 1 year. Well, at UCL, not to convert you or get you to move over or by any means, you could potentially take 5 years to do your master's, and that would give you plenty of time to kind of absorb and learn everything. Dr. Kuntz, how would that work? How would part-time or flexi time work at UCL?
Yes, so we have, possibly I should also explain it also relates to the student. So most students who are just graduated and they just did their bachelor, normally they just do the full-time degree in one complete year. But very often we have quite mature students, students who are working. So obviously they don't have too much time. They can either do the part-time degree in 2 years or the flexible degree in 5 years. Speaking from experience, most people who work full-time use the flexible route because even part-time 2 years sometimes is a bit too much. But it gives you the option. You can do the flexible study in 5 years' time. You can continue with your normal job that you already have, and you just need to look in the timetable when you need to take a few days to study at UCL. So these are the two options: full-time 1 year, part-time 2 years, or flexible study in 5 years.
Thank you.
So,
yeah, I think you mentioned that there are different ways of teaching, isn't it? There's kind of tutorial focus groups where they do group work together. And with the course itself, can it be completely face-to-face? Can it be completely remote? Or is it a bit of both?
So normally everything is face-to-face. And face-to-face means students have to come, they have to go to lectures, but we also have practicals, which means students sit together and they program something together, or they sit together and discuss a particular research paper, or they critique each other. So there's a kind of peer learning process. For example, in the dissertation module, they need to write a proposal, they need to present the proposal, they need to discuss the proposal with their peers. It's a bit a kind of a flipped classroom experience. We also have in very few instances, but just for one small module, we have a blended module. And that means it's just one module, it's an optional module people attend an online course and they have to come to UCL for 3 days, but that's just one optional module. The normal case is everything is face-to-face. The reason for that is we think that learning is better for students in a face-to-face setting, and they possibly learn better in a social environment. And we saw that this is the demand, and most people want face-to-face.
And I think that's wonderful. I know we are moving a lot more to remote and digital, but actually there's just something you can't take away. You know, you can't, it's so important to kind of do face-to-face stuff. And I think looking from the website, it talks about helping people harness like their entrepreneurial skills, which is so important with like skills, communication, group work, all the really important stuff. And it's good to hear that there's more working together as opposed to kind of working individually on their own projects. And you kind of alluded to some of the things that UCL has to offer, being a very renowned worldwide renowned university. Is there anything else in terms of unique selling points that UCL has to offer?
Yeah, very good question. So the USPs, I would say, you can do a collaborative project together with clinicians, data scientists, with our university hospital. So UCL, we also have an NHS trust hospital called UCLH, and many of our lecturers have dual positions. So they are clinicians at UCLH, but also at UCL itself. We also have projects together with industry, with a pharma industry and with consulting companies. That means in a few instances, people can do an internship directly with our industry partner, or a dissertation project with an industry partner. The degree currently has a high value on the job market. So usually our students get very quickly a job. Sometimes they even have job interviews before they even graduated. So this is what I can say from experience. And another USP is it's not just about the job market, it's also about your intrinsic motivation, what motivates you. And are you interested to use a digital skill set to improve prophylaxis, diagnosis, therapy, and prognosis of medical conditions? I think that's another USP, because many people do not just do a job because they want a job, they also see a higher meaning, a meaningful thing that they do on a daily basis. And lastly, you have the flexibility and freedom to conduct an own dissertation project. If you have an idea, and very often the best students come up with their own idea, they tell us, I have this in this project, I have this and this data set, and I really want to do that. And we support those students, we give them the right supervisor and help them to conduct their own dissertation project. So I would say these, yeah.
Thank you. Yes, because I saw that you mentioned, partners that you have in the industry and pharma, and I was looking, is IQVIA, you've got Roche, AstraZeneca, Public Health England, now called UK Health and Security Agency. And I was looking at that, I was like thinking, oh, I should have done this master's. Maybe I could have got a job in big pharma much more easily. But yeah, it looks really interesting. Yeah, there's paid internships, which is always very useful for students as well, working and studying at the same time. Good. And a few more questions. UCL is very renowned, and sometimes students might want to kind of jump ship and move over to UCL. Does the university accept previously completed modules from other institutions at all?
So the answer is yes, but it depends. So it depends, because I have to say that it depends if it's an equal content and the assessment methods are similar. Normally, this usually is not the case. So this is usually only in very few instances that people can bring in previous modules. So
Okay.
yes, but it depends. It is technically possibly, but it depends on the circumstances, to say.
And that's fair, because every university is different, modules are different. If in doubt, ask admissions, isn't it? I guess.
Correct.
Excellent. And with the postgraduate students applying, what kind of students do you typically get? What's the caliber like?
So it's a very mixed bag. So we have students with a quantitative background, people who studied computer science, math, engineering, or even finance. Those students are normally quite young. So they just have a bachelor and they just move on. So I have to say we have very young students, people who just came from the bachelor, but we also have very mature students, people who are already consultants, for example, and they just study the degree in a flexible mode. So they are already a radiologist, for example, in their 40s, and they just do the degree to further get a further qualification in their field. And then we also have clinicians. I would say the spread is about 2/3 are quantitative students and 1/3 are clinicians. And they come from all different specialties. So all kind of medical specialties you can think of. Not just clinicians. Sometimes we even have medical students who also do the degree in between before they finish. And then we have also people who study psychology or even one vet. So we have one person who's studying veterinary medicine, then biology. But the majority are people in a quantitative background or in clinicians. If people apply, we look carefully at their profile, even if they have not directly studied something before that, such as computer science. We will just look at experience, and if they have previous experience, we would still approve that. About our student body, it's very international. So UK, North America, we have also many from North America, from Asia, many, few from the EU, some from South America, Africa, and Australia. I would say the most are UK, US, and Asia. In that order, I would say that this is where our students come from.
Thank you. And then you mentioned the different modules that you offer, and I saw one of your compulsory modules is programming with Python for health research. Now I've tried to dabble in coding. I got as far as hello world, and then I stopped because people were telling me to kind of code in all these different languages, and I was like, too much information.
Yes.
For those who have learned code in a different language, how do you accommodate students who may not be familiar with Python or have zero experience with coding?
Yes. So what we do, I can just speak from experience. We have students who come to us who never programmed neither in Python or in any other programming language. However, we start from scratch. And for those students who need special support, we offer on a weekly basis drop-in sessions, tutorials we call them. Students can come there and we walk again through the material with them. This is on a optional basis. If students require that, we make that offer and students can just come and together we help them to code in Python. To give you an example, we had a student possibly 3 or 4 years ago. He was a clinician. He had no coding experience previously, but he submitted the best assignment of this course and he got the highest mark. So I think if someone is a bright student, he or she can just get a good mark and we give them all the support they want and require.
Good. That's really, and hopefully that will put some of our audience at ease. It's not about having previous knowledge in coding by any means. You can learn from scratch and it's absolutely fine and you will do well. And then with your optional modules, Dr. Kunz, I know that you'll say, yeah, all the modules are great, but if you had to choose your top 3 favorite modules personally, which ones would you go for? And don't tell me AI, because I've heard that to death already.
Yes. So yeah, no, you're right. So I would rather pick something different, not just AI. So for example, if I go back to the slide with the optional modules, I would, instead of specializing in one particular area, you could, of course, just use machine learning, advanced machine learning and AI, but I would rather mix it a bit, possibly advanced statistics, machine learning, and then depending on your interest, maybe genomics or public health data science. I would rather mix it, but that is just my personal opinion, and everyone has a different opinion on that.
Yeah, and that was the question. Absolutely fine. It's a personal opinion, and it just goes to show, you know, both universities, University of Strathclyde and UCL, have very different masters. They all have something to offer, definitely, and it really depends on the student and their personal preferences and what they're hoping to achieve from doing their masters and the course. And I guess bringing this webinar to an end, I hope you have all found it very interesting, insightful, and I guess, are there any final comments from either universities? Have you had any reflections listening to other people's courses? Is there anything that you would change about your course, perhaps?
Thanks, Lisa. I wonder if I could just go back to one slide that I didn't show before, just to kind of, now that we've heard Holger's, it might be a nice kind of final comparator between the two. If we could just switch over the screen share. If I just go back to, sorry, did this around first? My screen share.
Doug, what did you think of UCL's offering?
Yeah, I think yeah, it looks very interesting to me. I feel like for anybody who enrolls in the course from UCL, they would be very capable of doing data analysis in you know, health data analysis, and especially for those who are interested in machine learning methods. Yeah, I think that's very great.
Lisa,
Thanks.
is this the slide that you
Yeah,
wanted to show?
yeah, and I guess it just to kind of, you know, show the comparison from the UCL one, which is, as Duke said, as Holger has said, very data science driven. And the difference with our program is that it's that whole systems approach. So we have some data science piece, but we have the different aspects of digital health systems. So as I said earlier on about the co-design piece, so designing those agile and accessible systems, those participatory methods, to how to encourage users to work with those systems, from patients, citizens, professionals, you know, across the kind of spectrum. We do have some database and data management piece in there. That databases module and the data analytics module, as Duke said as well, in terms of that big data piece. But we do also focus on the legalities, the ethical pieces, the governance issues with accessing data and healthcare data. And what we're trying to do there is then introduce the students to the transferability and the relevance of different classes in different aspects. So they're working with the big data in the analytics module. In the previous semester, they've focused on those governance issues, the importance of understanding how to work with that information appropriately as well. And you've heard about the implementation piece, about developing, deploying, evaluation, and those give us that kind of real world context of how you get the systems, the technologies into the hands of users successfully as well. And thinking about how we work with different age groups, as I mentioned, and also the research methods that then do that kind of springboard into dissertation. So there's definitely some unique offerings between the courses, depending what students are looking for, whether that data science piece or that kind of whole systems approach to digital health systems and technologies. That's just one example.
Thank you. Yeah, that's it from me. Any final comments or any thoughts or remarks at all?